What are the BA4 and BA5 subvariants? Welcome to A Matter of Fact, a production of the Pan American Health Organization for Barbados and the Eastern Caribbean countries. I'm Nicola Barito. A Matter of Fact is designed to inform and educate you about the SARS-CoV-2 virus, which causes COVID-19, while taking an in-depth look at the benefits of vaccination. My guest is Dr. Prabhjot Singh, Advisor for Health Surveillance, Disease Prevention and Control at the Pan American Health Organization. Dr. Singh, thank you for joining us. A lot of conflicting reports about the BA4 and BA5 variants. Break it down for us, please.
So there's a lot of news floating around about the new subvariants of Omicron, BA4 and BA5, especially their spread in Europe and North America, US and Canada and Mexico has been all over in the news and newspapers. And what I want to point out is that it is a subvariant. It is not a variant. The variant continues to be Omicron. And while we will continue to see the subvariants, which could be BA1, BA2, BA3, BA4, and the names are unfortunately very technical to speak of and not easy to follow. And people might have that anxiety as to if this is a new variant of COVID-19 that is spreading around. But we have to be mindful, these are subvariants. And when we say subvariants, we mean that they share a lot between the original and the new ones that you might see, which basically implies is that not much has changed. We would see the same symptoms. The chances of getting infected with that would remain more or less the same and actually would vary more upon when you were vaccinated. If it was a long time ago or if you're not vaccinated at all, that would be much more of an importance than the variant itself, the subvariant itself, as to whether or not it will infect you personally. Are we seeing any increase in severity of cases? No, we don't see many more hospitalizations happening. We will see an increase in cases, which is what we are seeing in many places, but that is also something to keep in mind, that this increase is after a long time of the previous waves. The immunity of many people might be waning now. Many people around the Caribbean region and everywhere else actually got vaccinated when the Delta wave was around, which was somewhere in the middle of last year. And since then, now it's almost a year, the immunity has waned, both the natural immunity that you might have gotten, the vaccines that you might have gotten. And so there is a need to use boosters to get yourself boosted enough. And that's why the third booster, or at least the third dose, has been seen in many of the countries for the mRNA vaccines. So long story short, I would say that Omicron is not, the BA1, BA4 and BA5s are not something, a cause of concern. WHO has not actually come out with anything on a statement. And precisely because we continue to consider it as a variant, just like Omicron, they're just part of the Omicron variants. And so there is no cause of concern. Yes, we do need to continue to do surveillance. We do need the laboratories in the Caribbean region and elsewhere to keep on looking for these variants and other variants that might emerge, because only then we will be able to identify what is happening across the countries.
With that said, Dr. Singh, fact or fiction, the BA4 and BA5 subvariants, are vaccinated persons more affected?
Not at all a fact that Omicron is affecting more people who are vaccinated, not at all. Omicron is mostly, there is a reason behind why people might feel so. The new variant that we have, Omicron, has a lot of a scientific term called immune escape, which primarily means that if you had a vaccination before, or you had natural immunity with another variant before, there's a higher chance that you can still get the infection with Omicron. But that does not mean that even if you get the infection, that you'll be severely infected. Everything is a game of probabilities. And the severity of infection in vaccinated is much, much lower, especially if you have those risk factors. You're above 60 years old, you have diabetes, hypertension, or any other chronic diseases. And if you are vaccinated, the chances of you getting Omicron severe infections is very, very low if you're vaccinated, but not so much if you're not vaccinated, of course.
Thank you for your input, Dr. Singh.
My pleasure.
This has been A Matter of Fact, a production of the Pan American Health Organization for Barbados and the Eastern Caribbean countries. I'm Nicola Barreto. See you next time.